Jason Gale, welcome back to our podcast. And for all the viewers, welcome to part two. We're going to get into some more controversial parts of long COVID and what sense we can make out of it. And for those of you that was not part of the first episode, let me just do a recap. Um, Jason Gale has a phenomenal reputation, decades of looking at pandemics and pandemic preparedness around the world. And because he's based in Melbourne and works for Bloomberg News, he has a very unique perspective, not just a worldwide perspective, but about the United States as well. So I respect your view a lot. I have a great deal of respect of going through the amount of detail, the comprehensive detail, the way that you told the whole story is rather remarkable. And for anybody who wants to take a deeper dive, I noticed that the last 32 pages of your book, footnotes, references, and source material. So if you want to go deep, Jason is your guy. And I did go through some of those, and they are remarkably detailed. So thank you very much. We're going to take two very important topics today. One is what are the consequences, the generation of consequences we're going to have to deal with? And the other part of it is really, I would call maybe failures of, of data and failures of accountability. And you can take that any word that you would like, Jason. But I guess let's start with the accountability and what visibility you want to get at, because it's a very controversial subject here in the United States. We have very strong feelings, and there are pros and cons on both sides of the spectrum. But I think the data is pretty clear that during the COVID era, some people were favored, obviously, over others. Some were less valued than others. And I think that's for us to really face and understand what our reservations are to even look at that. And at the same time, because of our background, our cultural makeup at this point, I don't think that we're looking at who's going to be well served on COVID as well as COVID-19. So any distinction you can make would be terrific. So the microphone is yours.
Thanks, Peter. So I think if we look at, who was visible versus who was invisible, it was clear that essential workers had higher exposure, much higher mortality. Nursing home residents experienced concentrated mortality. It was pretty horrific for the residents and for the people caring for them. Communities with pre-existing health inequalities saw disproportionate impact. Long COVID patients often struggle to be recognized within fragmented specialty systems. Um, I think the bottom line is our system is optimized for acute episodes, not
Yeah.
multi-system chronic complexity.
Well, how do we address chronic conditions at this point then? We're looking at what? We're an aging society, right? And we have more and more chronic conditions because of aging, because of underfunding. How do we grapple with this? What
Well,
is,
I think we have to start with measuring impact as much as we can, and recognizing that pandemics aren't these acute shocks. That they're much more than that. They have much longer after effects, and so we need to be prepared for those, measure them, and continuing to sort of follow that impact. Um, Obviously, the US healthcare model, specialty silos, you talked about patients needing to quarterback their own care. Multidisciplinary long COVID clinics, exist, as we mentioned before, but are limited and unevenly distributed. And as we talked about before, primary care is often the default entry point, but dedicated resources are often insufficient.
but you've made the statement a couple of times that chronic illness is basically less visible than acute care, obviously. But there is so much chronic care. How is it that it's not as visible as acute? Is it a question of funding? Is it a question of research? Is it a question of media? Why is it is so large and growing? Why is it not as visible?
Well, I don't think it's as exciting and, sexy, if you like, when there is an immediate emergency. That's exciting. People progressing slowly into heart failure. That's not as certainly not as exciting for the media to cover. Um, so, I think there is that. It's interesting because news organizations these days are able to tell in real time what stories resonate with readers,
Right.
and it's not why we can blame the media for not reporting certain things. The media report things that people want to read, and if people are not interested in the chronic, the consequences of COVID illness, then we won't report on them. And I think that the appetite for stories on this has definitely declined, and so it's much less visible on that front.
Well, I certainly recognize that most of us don't want to deal with the aging population and all of our grandparents and elderlies coming down with just co- horrendous chronic conditions. And maybe one of the avenues you go to Reddit and you find a group that you resonate with and you trade stories. But I think one of the real tragedies coming up is we're going to have to figure out how are we going to make this more visible, begin to fund this, and coordinate in a very different way than we have in the past. And one of the things that you've mentioned, I think, is just spot on, is the capacity. Well, it's a public health capacity that I think you've mentioned numerous times throughout the book. And you both have a question on the public infrastructure capacity, but also the whole trust issue. As I've worked with a number of groups around the country, and even those that are trying to implement social infrastructure investment initiatives, they all talk about progress is basically travels at the speed of trust. So when you use the word about trust and about the public health system and the public health infrastructure, where did the trust go? How do we get it back?
Yeah, look, I think COVID showed us very clearly that pandemics are social events as much as biological ones, and
Yeah.
they expose structural fractures. Trust definitely declined during the pandemic and remains fractured. I think there's, a lot of fatigue. People are just tired of this whole subject and wanting to move on. But there's, mistrust for sure. I think there's still, I was talking to somebody who works in pharmaceuticals, who was, a senior manager, I thought would have been very well aware of the scientific literature, who was adamant that ivermectin was a proven credible therapy for COVID-19 when the evidence does not support that view. So, I think that what I understand to be well-established fact is not necessarily reflective of what people broadly think. And, obviously it can come down to where you're getting your information. Um,
Well, you also mentioned that the surge and neglect funding cycles. Talk more about that.
Yeah, well, when there is an acute crisis, there's, attention, media latch onto it, there's funding. But when that is over, we get this flip-flop where, there's no stable public health funding. It's all sort of emergency
Right.
driven. And clearly, we pay the penalty for that. I think about here in Australia, Melbourne in particular, there was a real tendency to keep flipping that lockdown lever because the public health system, the infrastructure wasn't there to do adequate testing and contact tracing to stop transmission, as well as a country like South Korea, which was able to avoid, long-lasting mass lockdowns because it had a really well-equipped public health infrastructure to test and to do the sorts of surveillance and contact tracing needed to stop transmission.
Well, I also like your analogy about trust as infrastructure. Now, we don't usually think that trust is an infrastructure component per se, but I think it comes down to trust and how you build that trust on a cross-cultural basis. And one of the things I keep coming back to is institutional trust, and it's obvious that during COVID, certainly over the first three years of it, there was a real loss of trust in civic institutions right across the board. And I'm curious that as you look at institutional trust, whether it be on the clinical side or governmental side, what is the road to building trust for a population that we basically wish we didn't have to focus on? Is this a public
Yeah,
issue? Is it a societal civic issue? How do we frame this in a more constructive way?
I think that we need to look to countries like Denmark, for example, where there is a high level of public trust,
Yeah,
to understand more about how they did that. I did interview Soren Brostrom, who was the head of their public health institute, and he told me that he worked very hard to reach traditionally groups. He went to mosques, for example. He went to
yeah.
churches and to places of worship where people may not be necessarily speaking Danish. And he made sure that the people were getting good information. I think some other people who have looked at this. I'm thinking of Caitlin Jetelina, your local
Sure.
epidemiologist, who spent a
Yeah.
lot of time working with groups at the grassroots level to sort of understand more about trust and how people get access to information and how they develop their thoughts and sentiments on these things. So I think we need to lean into people who have got good experience in understanding public trust and how to build it and recover because yeah, where we are right now, there are big gaps.
Well, there's a lot of talk about the trusted messenger, who's the
Yeah.
trusted servant that you want to get your information from. It may be more likely at the hair salon than it would be at your emergency walk-in clinic. But I'm curious, now you have a phenomenal background working with observing countries all around the world. Do you have a sense of, if you look at whether it be Western Europe, Asia, even the Middle East, are there any systemic indicators that you look at that other countries seem to have come up with, not necessarily um, the key to success, but what are other countries doing that, as you look back on it, they probably made some steps in the right direction where the US didn't? Can you begin to frame for us what kind of things seem to be working in other countries?
Well, I think removing the politics, getting experts to provide the scientific evidence, and then for politicians to interpret that into policy. And I think understanding more clearly the different roles uh, is important. I think having politicians dispensing medical advice, which, in the recent history of the US has often been, incorrect medical advice,
Yeah.
advocating for use of treatments that were frankly not based on evidence. That's not helpful. So, getting a trusted experts to provide guidance, I think, is important, and then for recognizing how that needs to be translated into policy, essentially by policymakers.
Well, a phrase that uses clearer risk communication. Can you
Yeah.
unpack that? What does that mean?
Well, I think it's uh, being transparent about the certainty with which we know or don't know certain things. Um, so, for example, the use of face masks became a real sort of lightning rod subject because there was a shift from don't wear masks because you're going to take them away from healthcare workers who need them, and discussions about their efficacy to suddenly, everyone should be wearing masks, wear fabric ones, and things like that. That does certainly create some confusion. And I think it's important that we frame some of these questions a little bit more thoughtfully, where we address the fact that the evidence on masks showed that wearing them in crowded indoor spaces will reduce your risk of infection. That's kind of one example I would mention, but essentially just being a lot more transparent on how certain we know things for sure. I come back actually in my mind to one of the things that the WHO, the World Health Organization, tweeted early in the pandemic was that it said that it was misinformation that COVID was airborne. And of course, we now know that SARS-CoV-2 can be spread through the air in infectious aerosols. And that definitely did point to the need to filter the air and for better ventilation and air quality, but also pointed to the risk reduction afforded by face masks.
I mean, that seems airborne ventilation and mitigation, that seems pretty obvious, isn't it? I
It
would think
does
it's
now.
obvious. It's very
It does
practical.
now. But I think that that comment was, based on what we knew about the Middle East respiratory coronavirus MERS and SARS-CoV-1.
Yeah.
And that was sort of extrapolating without real evidence. And in fact, the evidence was showing the contrary, that SARS-CoV-2 was in fact airborne. So, I think a lot of this is nuance, but the public, I think, is capable of understanding nuance better than what we think they are.
Well, I'd like to give them the benefit of the doubt. Let's
Yeah.
let's let's go to. I don't want to get into winners and losers. That's not very productive. But when you look around the world and you look at the United States, um, what's a constructive way forward? Are there some pretty common sense things we can maybe agree on, or at least move towards agreement and exploration more so than we did during COVID-19?
Yeah, look, I think that we can all agree that these infectious pathogens of pandemic potential are likely to cause illness way beyond the acute phase, and that, it's really important that we think about their long-term effects, measure them, prepare for them, support those who are affected by the long-term consequences. Um, I think it's very clear that this pandemic didn't just test our hospitals, it tested how we measure health, how we organize care, how we sustain public trust. It, exposed blind spots, especially around chronic illness that follows infection. And I guess it's a reason more for despair, not, it's not a reason for despair. It's a reason for refinement, really.
So if you were running the government system, pick your country, doesn't matter, but pick the United States, what would you want to recommend? Two or three things you think would be constructive, possibly unifying, and and helpful? What is within our grasp, let's say the next 5 years?
Right. Well, I think looking at the reasons for distrust and working to repair that, to you know, s working with smart people like Caitlin Jadalina, who is investing a lot of time and understanding
Yes.
sources of trust and how to build that. Continue with that effort on a much wider scale. I think definitely preparing for pandemic threats, investing in them, how to test for them, recognizing that surveillance will be important, knowing that widespread public measures like lockdowns are not going to be as well. Would probably just not going to be as usable as they were back in 2020, and working with that basis that we're going to have to do better to avoid those the need for such blunt tools. Um, what else? Certainly, the need for measuring impact beyond hospital beds and mortality to understanding more and preparing for that chronic wave of illness. Um, I'm sure. Recognizing, that public health spending has to be constant. We can't just go from putting money in when there's an emergency and then pulling it out when there's not. It needs to be consistent, and we need to sort of integrate the lessons learned from COVID into our current response to healthcare needs and potential threats.
Well, I have to ask you a question that I've been dying to ask you that, and it's an unfair question. Is there going to be another pandemic?
Of course, yeah. I mean, throughout history, these events have occurred, but if you look at the factors that are driving pandemic threats, deforestation, changes in the natural environment that increase the contact humans have with wildlife, therefore increasing the potential for spillovers of pathogens carried by wildlife into human populations. That certainly increased. Climate change is hastening that. So really, all of the factors, population increases, urbanization, these things, globalization, of course, increase the risk. It's not a case of if, but really when, sadly.
Well,
I
there's
don't
a
want there to be another pandemic. I really do not, but I think unfortunately we can count on it.
there's a American cultural characteristic that rugged individualism. We we beat COVID-19. We'll beat it the next time. So my question is, if we had another pandemic, I think the odds in the research community and the climatologists said it's more likely in the next 1 to 2 decades than at any other time in the last 100 years, for many of these same factors. We're not quite sure if it be South America, it could be anywhere. Is it likely to be a replay of COVID-19? We have a proven vaccine that could mitigate a lot of the risk and the treatment, but it's probably unlikely it'll be exactly like COVID-19. It may be more virulent, may be mutating even quicker. What is what is your view on what it could look like if it's not going to be the same? What might it look like?
Oh, look, we know that it will have to be a pathogen to which humans lack any natural immunity. It's likely to be transmissible through the air, like SARS-CoV-2 is, because that's how infectious threats spread, very efficiently. But it could be vector-borne. There are other, potential ways of transmission. Um, I feel like it'll surprise us like SARS-CoV-2 did. Who knows? It could be influenza, our traditional pandemic threat. H5N1, although it has not developed the ability to transmit efficiently between humans, is certainly in a lot more mammalian species, which increases the risk of adaptation. Um, so, yeah, I don't, it's anyone's guess what the next one will be, but I think there's a good chance it'll be very different to COVID. So I think we have to be prepared for that eventuality and realize that our pandemic plans must be nimble. They can't be based on influenza, which, a lot of our pandemic plans were. We know that influenza has a much shorter serial interval period. It's much more conducive to symptom-based surveillance than COVID was. COVID having such a large proportion of asymptomatic infections made surveillance really important. Now we have tools at our fingertips like wastewater surveillance. Hopefully, we should be able to see where these novel pathogens are circulating in our community and we can be more targeted. And so, we do have better tools available. We have mRNA vaccinations, which, if they're adequately funded, could be useful. But, we know that there's been that faces challenges. We know more about ventilation and air quality, for sure, but we also know that there is a large public that is just way less trusting of science, vaccines, and public institutions, and that I think is going to be our biggest impediment.
Well, you've certainly articulated the fact that we have to get our act together, more so than we have in the last decade. Are there other countries that you look towards that are basically taking pandemic preparedness and all the various models that we could construct and gameplay through it? Are there governments out there taking pandemic preparedness seriously?
Oh, look, I think there are. I It's not something that I've looked at in detail. So, but what I think is kind of missing is a uh, an event where we could learn broadly from countries that did a much better job at avoiding large mortality. That did maintain much more social cohesion, avoided long-lasting lockdowns. I'd really like to learn more from Vietnam and South Korea and Denmark and Norway and those countries because I think that there are things that everyone can learn and apply to their own situations to be better, to be more resilient,
Yeah,
effectively.
you sound almost optimistic.
Well, I'm not sure that any such meeting has happened, but I think we really do need to be studying the factors that led to improved outcomes in certain countries and worse outcomes in others. In Bulgaria, for example, about their excess mortality was equivalent to about 1% of the adult population. I mean, that's horrific. And I think it mostly came down to a distrust in vaccines, and
Uh,
um, I that's yeah, that shows how bad things can be, and we really need to make sure that that's avoided.
I think that's a good note to close on. I think there is optimism. We know what the problem is. We know how extensive it probably will be, or could be. And I think if we have more clarity and more courage to take a look at what other countries have done, regardless of what their demographics are and their cultural history, I think we really can learn from peace parts around the world. I I don't see any appetite for a national commission to look at that. There may be research and foundations that may, but I don't see an appetite right now to take those next steps, which I think is part of the subtext of this remarkable book that you put together, that there will be another pandemic and there will be
Yeah,
a great deal of more
I agree.
mortality and more.
I think if we acknowledge the full arc of what happened, the acute crisis and the chronic aftermath, we're in a much stronger position for whatever comes next.
Let's close on that note. And Jason Gale, you have just made a tremendous contribution to our learning. I've learned from you in the last few weeks as I've gone through your book, and I think our listeners will be well served to read your book. In fact, read it more than once. But this is just a very consequential book that I've grown because of it. I hope the rest of our viewers do as well. And
Thank
I
you.
want to
Thank
wish
you
you
so
very
much.
well on your book tour. That in itself can be very optimistic. And I wish you well. Thank you very much.
Thank you,
And
Peter.
a pleasure.
All right.
Thank you.
Take care. Bye.